All right, so let's jump into a case here that really tests our orthopedic knowledge.
Okay.
We've got an 88-year-old woman who was found on the floor in her nursing home,
Oh, wow.
and we suspect a hip fracture.
Mm-hmm.
Now, what makes this case particularly interesting is the need to make really quick decisions
Right.
while considering her age, her overall health, and the specifics of the injury itself.
Yeah.
It's about finding that sweet spot between, rapid response
Yeah.
and providing tailored treatment.
You're absolutely right. This isn't a textbook case where we have all the time in the world to, sit and ponder. And
Yeah.
every decision we make has a ripple effect on this patient's recovery
Yeah.
and their long-term well-being.
Absolutely. So walk me through those first few critical moments.
Sure.
You arrive at the nursing home. You see this patient in pain.
Mm-hmm.
What's the immediate priority?
So the first thing is to stabilize the patient.
Okay.
And, remember your ABCDEs?
Right.
Airway, breathing, circulation, disability, and exposure?
Of course.
We need to make sure her airway's clear, she's breathing adequately, check her pulse and blood pressure,
Okay.
assess her neurological status to make sure there are no other injuries.
It's amazing how those basic principles become even more crucial
Oh,
in
absolutely.
a situation like this.
Yeah,
Really?
right. Yeah, and alongside that, we also need to address her pain.
Right.
A simple foam gutter splint can help immobilize the leg
Oh, okay.
and provide some relief.
Pain management's key not only for the patient's comfort, but also to get a clearer picture of what we're dealing with.
Exactly.
Hmm.
Once we've stabilized her, then we can move on to a more detailed investigation.
Okay.
We need to understand what led to the fall, her medical history medications, previous falls.
Mm-hmm.
Did she trip, or could an underlying medical condition have contributed?
It's like detective work, piecing together those clues to understand the full picture.
Absolutely.
So what kind of tests would you order at this stage?
So an X-ray is crucial to confirm the fracture and determine the type. In this case, it's likely an intertrochanteric fracture,
Okay.
which means the break is in the region below the hip joint.
So not the neck of the femur.
Exactly. So besides the X-ray of the hip,
Okay.
we would also order a full set of blood work, including a clotting screen, to assess her overall health and suitability for surgery.
Okay.
An ECG would be necessary to evaluate her heart function,
Right.
especially given her age and the presence of a pacemaker.
So we're not just focusing on the bone.
No.
We're evaluating her entire health status to ensure that we're making the best decisions.
Precisely. We want to be proactive in identifying any potential risks or complications before we even consider surgery.
Okay, so speaking of surgery, let's talk about the options for treating intertrochanteric fractures.
Okay.
What are the standard approaches in a case like this?
So in the past, prolonged bed rest and traction were the norm.
Oh, wow.
But nowadays, surgery is generally the preferred approach.
I imagine surgery offers a faster recovery and fewer complications associated with prolonged immobility.
That's right.
Yeah.
A dynamic hip screw fixation is a common procedure for these fractures.
Okay.
It involves inserting a screw across the fracture line, allowing for controlled movement and promoting bone healing.
And how does the surgeon ensure that that screw is placed correctly? I imagine precision is paramount here.
Absolutely. We use a technique called fluoroscopy, which provides real-time X-ray imaging during the surgery.
Wow.
This allows us to guide the screw placement with pinpoint accuracy.
So it's like having X-ray vision seen right through the tissue to guide those instruments?
Exactly.
It's incredible how technology has revolutionized orthopedic surgery.
Indeed, this type of real-time imaging has minimized complications and improved outcomes tremendously.
Yeah.
However,
Yeah.
we must always be mindful of potential complications.
Of course.
A major concern with hip fractures, especially in older patients, is a vascular necrosis.
Could you explain what a vascular necrosis is and why it's particularly relevant in this case?
Of course. So a vascular necrosis occurs when the blood supply to the femoral head, the ball-shaped part of the hip joint, is disrupted. Think of it like a plant being deprived of water. It starts to wither and die.
So without proper blood flow, the bone tissue can't survive.
Exactly. And the anatomy of the hip makes this a real concern, especially with displaced fractures. The blood vessels supplying the femoral head are delicate.
Right.
And run along the femoral neck, the area that's often fractured.
So in our patient with her age
Right.
and the type of fracture of vascular necrosis is a real possibility.
Unfortunately, yes. The risk increases with age and the severity of the displacement.
Okay.
That's why we need to carefully consider her overall health and weigh the potential benefits of surgery against the inherent risks.
I see it's a delicate balancing act.
It is.
So how would you approach surgical decision-making in this specific case?
Right.
Considering her age and pre-injury mobility level.
That's where things get even more interesting. We have to tailor our approach to the individual patient.
Yeah.
In an elderly patient like this, with potentially limited mobility even before the fall,
Right.
the focus shifts towards regaining functional independence as quickly and safely as possible.
So a faster recovery would be the primary goal.
Exactly.
Okay. What kind of surgical options would align with that objective?
So a hemiarthroplasty might be the most suitable choice.
Okay.
This involves replacing the damaged femoral head with a prosthetic implant while leaving the hip socket intact.
Okay.
It's less invasive than a total hip replacement.
Right.
And allows for faster recovery.
So it's like a partial hip replacement.
Yeah.
Focusing on the damaged part of the joint.
Yeah.
And how does this implant attach to the bone?
So there are two main methods, cemented and uncemented.
Okay.
Cemented implants use bone cement to fix the prosthesis in place, providing immediate stability.
Okay.
Uncemented implants, on the other hand, rely on bone growing into the porous surface of the implant over time.
I see.
The choice depends on factors like bone quality and the patient's activity level.
It's fascinating how we can choose the right approach based on the individual patient's needs and the specific characteristics of the fracture.
It really highlights the advancements in orthopedic surgery and the focus on personalized care.
Yeah.
We're not just treating a fracture.
Right.
We're treating a person.
Absolutely. So speaking of tailoring treatment, I'm curious, how would the approach differ for a younger, more active patient with a similar fracture?
That's an excellent question and one we'll discuss further.
Okay.
For now, let's take a closer look at why a hemiarthroplasty might be the best option for our 88-year-old patient.
Okay, let's explore that in more detail.
So we were just discussing why a hemiarthroplasty might be the preferred choice.
Yeah.
For our 88-year-old patient with an intertrochanteric hip fracture.
Right. You mentioned that it offers a faster recovery compared to other options.
Yes.
Could you elaborate on why that's so crucial in this particular case?
Sure. So think about the challenges an elderly patient faces after a hip fracture. They're often dealing with other health issues, decreased mobility, and a higher risk of complications from prolonged bed rest.
Like a domino effect, one problem leading to another.
Exactly. A hemiarthroplasty allows us to get them back on their feet sooner.
Yeah.
Reducing the risk of those complications, it's about restoring their independence and improving their quality of life.
And I imagine that quicker recovery also has a psychological benefit.
Oh, absolutely.
You know, being able to move around sooner can boost their mood and overall well-being.
You're absolutely right. The psychological aspect is often overlooked, but it's incredibly important.
Yeah.
Feeling helpless and dependent can take a toll on anyone, especially someone who's already facing the challenges of aging.
So in this case, we're not just repairing a bone, we're trying to restore a sense of normalcy and independence for this patient.
Precisely. And that's why the choice of surgical procedure goes beyond just fixing the fracture. It's about considering the whole person and their individual needs.
Now, you mentioned that a hemiarthroplasty wouldn't necessarily be the first choice for a younger, more active patient with a similar fracture.
Right.
Why is that?
That's a great point. For younger individuals, we aim to preserve as much of their natural hip joint as possible.
Okay.
We want to think long-term, considering their higher activity demands and longer lifespan.
So a different approach would be needed to achieve those goals.
Yes. In these cases, we might opt for open reduction and internal fixation, or ORF.
Okay, break that down for me. What does ORIF involve, and how does it differ from a hemiarthroplasty?
So with ORIF, we make an incision to access the fracture site, carefully realign the broken bone fragments, and then secure them in place using plates, screws, or rods.
Okay.
It's like putting a puzzle back together and then using hardware to hold those pieces securely.
Yeah. It sounds more complex than a hemiarthroplasty.
It can be.
What are the advantages of this approach for a younger patient?
So the main advantage is that we're preserving their natural femoral head, the ball part of the joint.
Right.
This can delay or even prevent the development of arthritis later in life.
So it's a more anatomical restoration of the joint.
Yes.
Which is crucial for someone who's going to be putting more stress on that hip over time.
Exactly. And that's why it's often the preferred choice for younger, more active individuals.
But even with ORIF, is there still a risk of complications like a vascular necrosis?
Yes, unfortunately, that risk remains.
Okay.
Remember, the blood supply to the femoral head is delicate.
Yeah.
And can be disrupted during the injury or even during the surgery itself.
So even with our best efforts, we can't completely eliminate that risk.
That's right. It's a reminder that surgery is always a balance of risks and benefits.
And that highlights the importance of that initial assessment, understanding the patient's individual risk factors, and choosing the surgical approach that best aligns with their needs and goals.
Absolutely. It's a team effort involving not only the surgeon, but also the patient, their family, and the entire healthcare team.
It's personalized medicine in action, taking all those factors into account to create a tailored treatment plan.
It is.
Now, we've talked a lot about the surgical aspect of hip fracture management.
Right.
But what about the recovery process? What can patients expect after surgery? And how do we help them regain their mobility and function?
That's a crucial part of the journey, and one we shouldn't overlook.
Right.
Post-operative care is essential for a successful outcome.
So it's not just about fixing the bone. It's about supporting the patient through their entire recovery process.
Exactly. Post-operative care involves managing pain, preventing complications like blood clots, and starting a structured rehabilitation program.
What does that rehabilitation program look like?
So it typically involves physical therapy to help regain strength, range of motion, and balance. The goal is to gradually increase their activity level while minimizing stress on the healing hip.
So it's a gradual process tailored to the individual's progress and tolerance.
Exactly. And it requires patience, persistence, and a positive attitude.
I imagine the healthcare team plays a key role in motivating and encouraging the patient throughout this process.
Absolutely. We're not just medical providers. We're coaches, cheerleaders, and sometimes even therapists. We need to be there to support our patients every step of the way.
And I imagine the support of family and friends is crucial as well.
Oh, absolutely.
Having a strong support system can make a world of difference in someone's recovery.
You're absolutely right. The human connection is just as important as the medical intervention.
So we've covered the initial assessment, surgical options, potential complications, and the importance of post-operative care.
Yes.
What are some key takeaways for our listeners who may not be orthopedic surgeons but want to understand the complexities of hip fracture management?
Well, I think one key takeaway is the importance of a systematic approach. From the moment we encounter a patient with a suspected hip fracture, we follow a structured protocol to ensure their safety and well-being.
It's like a well-oiled machine, with each step designed to optimize the outcome.
Exactly, but it's not just about following a checklist. It's about understanding the why behind each step, the rationale for our decisions, and the potential consequences of our actions.
It's about thinking critically and applying our knowledge in a way that benefits the patient.
Precisely. And another important takeaway is the individualized nature of hip fracture management. We're not treating a fracture, we're treating a person.
Right. It's about tailoring our approach to the individual's age, health, activity level, and goals.
Exactly. And that requires open communication, shared decision-making, and a deep understanding of the patient's values and preferences.
It's about seeing the person behind the fracture, understanding their story, and working together to achieve the best possible outcome.
Absolutely. And I think this case also highlights the incredible advancements in orthopedic surgery.
Yes.
We've come a long way from the days of prolonged bed rest and traction.
We now have a range of surgical options, advanced imaging techniques, and a deeper understanding of the healing process.
It's truly remarkable how far we've come and how much we continue to learn and evolve.
Speaking of evolution, I think it's important to acknowledge that hip fracture management is a constantly evolving field. What was considered standard practice a few decades ago might be outdated today.
That's an excellent point. We must stay abreast of the latest research, embrace new technologies, and be willing to challenge our assumptions.
It's about being lifelong learners. Always striving to improve our skills and provide the best possible care for our patients.
Exactly, and that's what makes this field so exciting and rewarding.
Yeah, it really is inspiring to see how this field is constantly pushing the boundaries, using cutting-edge technology and techniques to improve people's lives.
It really is, and it all comes back to that core principle of helping people regain their mobility, their independence, their quality of life.
Exactly. We've delved really deep into the mechanics of hip fracture management.
We have.
But I think it's crucial to circle back to the human element. Behind every fracture, there's a person with a story, with fears and hopes for the future.
Absolutely. We can't lose sight of that individual amidst the complexities of medical procedures and protocols.
Right.
It's about treating the whole person, not just the broken bone.
And that brings us to a really important consideration.
Okay.
We've discussed the various surgical options and the factors that influence decision-making.
Right.
But what about the patient's role in all of this?
Yeah.
How do we empower them to be active participants in their own care?
That's a crucial aspect of modern medicine.
Yeah.
Shared decision-making. It's about ensuring that patients have the information they need to make informed choices about their treatment. We need to explain the options clearly in a way that they understand and address any concerns they might have.
It's about bridging that gap between medical jargon and everyday language, making sure they feel heard and understood.
Exactly. It's a partnership, a collaboration between the healthcare team and the patient.
And that partnership extends beyond the operating room. We've talked about the importance of post-operative care and rehabilitation. But I think it's worth emphasizing the role of ongoing support and encouragement.
Absolutely. Recovering from a hip fracture, especially at an older age, can be challenging both physically and emotionally.
Right.
Patients need that continued support from their healthcare team, their families, and their communities.
It's about providing not just medical care, but also emotional support and practical guidance to help them navigate the challenges of recovery and adapt to their new reality.
You've hit the nail on the head. It's about recognizing that healing goes beyond the physical.
Yeah.
It involves addressing the emotional and social aspects of well-being as well.
So as we wrap up this deep dive into the world of hip fractures, I want to leave our listeners with a thought-provoking question.
Right.
Something to ponder as they continue their own exploration of this fascinating field.
I'm all ears.
We've focused primarily on the medical and technical aspects of hip fracture management.
Right.
But what are the broader implications of this injury, both for the individual and for society as a whole?
Yeah.
How can we as healthcare professionals and as a society create a more supportive and inclusive environment for individuals recovering from these injuries?
That's a profound question.
Yeah.
And one that deserves further exploration. It challenges us to think beyond the immediate medical needs and consider the long-term impact of these injuries on individuals, families, and communities.
It's a reminder that healthcare is not just about treating diseases and injuries. It's about promoting well-being in all its dimensions.
Beautifully said, and I think that's a perfect note to end on.
To all our listeners out there, whether you're a seasoned medical professional or someone simply curious about the complexities of the human body, keep asking questions, keep learning, and keep striving to make a difference in the lives of those you touch.
And remember, the world of orthopedics is full of challenges and rewards.
Yeah.
It's a field that demands both intellectual rigor and heartfelt compassion. If you're passionate about making a real impact on people's lives, this might just be the path for you.
Until next time, stay curious, stay informed, and stay well.